year, 200,000 people here in the U.S. are diagnosed with an abdominal aortic aneurysm. The vascular surgeons at the Vascular Institute of San Antonio are specially trained to diagnose and treat patients with AAA. And we're learning more today with Dr. Seth Fritcher. Good afternoon. Thanks so much for having us here.
Thank you for having me.
So let's talk about this condition. How serious is it?
Aneurysms can be very serious, actuality. They grow at different rates, and they can be located in any area of our body. So anywhere where there's an artery, there can be aneurysmal development. And basically, the easiest way to think about what an aneurysm is like a balloon. Let's just break it down into simple facts. A balloon, when you blow air into it, it expands, and eventually the wall strength of the balloon will be overcome by the internal pressure. And that's basically the physics that we're dealing with aneurysm disease. The number one area for an aneurysm to occur is actually in the infrarenal aorta, which is kind of what we're talking about today.
And so what symptoms should folks look out for?
With today's technology, most people don't even know they have an aneurysm. They're diagnosed with it by some other means. It's found by accident. And so a lot of our patients that come to the Vascular Institute of San Antonio, they don't even realize why they're here because they had a CAT scan or an MRI or a spinal x-ray that showed an aneurysm. They didn't even know about it, and they're asymptomatic. And so of those people who do know that they have an aneurysm, and what we do in our education process is tell them what to look for, the aorta is actually located on the left side of the spine. So it's actually in the back. And so they can have tearing back pain that radiates to the inner thigh or abdominal pain. It's a sensation that you know something immediately is not right.
Wrong, right? Yeah. So are certain people more at risk?
There's a lot of different risk factors that are associated with aortic aneurysm development. Most of them are out of our control. There's a genetic inheritance pattern, a first-degree familial pattern, so father to child, but not father to grandchild. Age, we can't really control that. As we get older, our body just wears out on the interior. Males and Caucasians typically have higher risks than others.
Okay, and is it treatable, and what kind of treatments are available?
There's all kinds of technology that's available. That's one of the great things about medicine in these days. Most of the patients who have aneurysms that we treat are done minimally invasive. The stent technology has been around for over 20 years, and it's just so good that most of us can treat aneurysms in that method, which is a benefit to our patients. Overnight stay in the hospital, it's done percutaneous, meaning no incisions.
Right.
We treat it from the inside, and then we can follow it from that point on.
All right, and real quickly before we go, tell us more about the Vascular Institute of San Antonio.
The Vascular Institute of San Antonio is comprised of 7 vascular surgeons that are practicing arterial surgery right now in San Antonio and South Texas. Our base is here in San Antonio, but we have satellite offices all throughout South Texas, and we treat a variety of vascular conditions. That includes arterial, venous, lymphedema, the whole gamut.
All right, Dr. Seth Fritcher, thank you so much for all that important information. The Vascular Institute of San Antonio is on Huebner Road in the Medical Center. For more information, all you have to do is give them a call at 210-962-5709 or visit the website vascularinstitutesa.com.